Yeah, so with the bowel, usually it can just mimic IBS. So, somebody who has bloating, pain with bowel movements, especially during periods, you can have sometimes blood in the stool, and that's just caused due to inflammation and the sloughing off of some of the lining of the bowel. So it's not necessarily that you have endometriosis growing through the bowel, right? Because that would be a sign of much more advanced endometriosis. But even with some implants near the bowel can have that effect of bowel issues, bowel symptoms. So definitely if IBS has been suspected in the past, but also your symptoms are very cyclical, endometriosis is a possibility. Bladder, it can be frequent urination, painful urination. Again, it typically tends to be cyclical around the cycle, but yeah, endometriosis is suspected in those cases. Also, there's a condition that's called interstitial cystitis, which is very common and commonly coexists with endometriosis. And that's sort of inflammation of the lining of the bladder, which produces symptoms similar to a bladder infection. So, pain, frequency, kind of irritation. So that's not uncommon, and that, needs to be investigated.